With COVID concerns settling down, many companies are bringing their employees back to work in the office. And for some, that's a really big change after nearly 2 years of working from home. It also presents a unique set of challenges for moms who are nursing. So Dr. Marta Perez is a WashU OBGYN at Barnes-Jewish Hospital joining us this afternoon. Glad to have you with us.
Thanks so much for having me.
So I understand this is something that a lot of your patients have talked to you about, but also a journey that you went through, I went through. So tell me a little bit about your journey going back to work.
Yeah, so during maternity leave, when I was home with my baby, and myself and many other parents are able to directly breastfeed, which is a simple way to provide human milk, which has lots of nutritional benefits for baby and for the mother.
Right.
But when we go back to work, if a parent still wants to provide breast milk, then they will have to pump breast milk and then feed the baby express breast milk when they're not together. So that can be a big change, especially if someone has been only breastfeeding at home.
Right. So what are some of the challenges that patients are experiencing as they're returning to work, and how can women prepare for these ahead of time?
Yeah, so a few things to note. One is that all insurances are required to provide an electronic breast pump. The best time to get one is actually at the end of the pregnancy, so you have it at home during the postpartum period. Sometimes it can be used even before return to work, but you're gonna maybe wanna try it a few times before that first day back.
Right.
Another thing to know is what kind of breast pump you like and what your workplace accommodations will be for lactation. It's really important that parents know that there is federal protection over lactation time and space.
What does that mean? What are those protections?
Yeah, so the Affordable Care Act, when it was passed, required protections for lactating individuals who return to the workplace. The workplace is required to give the lactating individual enough space and time to express breast milk, and there's no limits to that time, and a private location that is not a bathroom in order to express milk. Unfortunately, that law covers those covered by the Fair Labor Standards Act, which doesn't include all employees in the U.S. There are several states who have additional protections, but unfortunately Missouri and Illinois aren't two of them. So in our region, you'll want to check if you're covered by the Fair Labor Standards Act, which gives you the federal protections. But even if you're not, many employers are very supportive of lactation in the workplace and want to accommodate and want to reach those accommodations. So definitely something to inquire about.
To ask about for sure. And I, at home, always said, whoever said the phrase, "you don't cry over spilled milk," had never spilled breast milk. We know that that is liquid gold. Every single little drop counts.
Exactly.
So there's a lot of stress and anxiety that goes along with parents returning to work and trying to hand off that breast milk to maybe another caregiver to give to the baby. Talk to me about that.
Yeah, I think one of the big challenges that I hear from my patients, and even other physician moms too, is that when another caregiver is giving express breast milk, that caregiver may not have as much experience with breast milk, human milk, and the physiology. A really great example of that is that human milk changes over time to meet the needs of a baby. And so the volume of milk that a baby consumes through the first 6 months of life actually doesn't increase after those first few weeks. It stays the same. Whereas formula-fed infants, the amount will go up as nutritional needs change. So that's a big difference. A caregiver might say, well, I'm used to feeding babies 5 ounces, 6 ounces at a time every few hours, whereas a human milk and a breastfed baby may only take 3 to 4 ounces. So sometimes a parent has to really advocate for themselves to make sure their baby isn't being overfed, or perhaps they're being made to think, I'm not making enough milk when we're apart to feed the baby when we're apart. A really great tool to keep in mind is for every hour of separation, it's about 1 to 1.25 ounces. And that's for a total intake of about 25 to 30 ounces per day, which is what breastfed infants take through the first 6 months of life.
Okay, good information. Glad to have you with us this afternoon. Thanks so much for sharing. You can find Dr. Perez at the OBGYN department at Washington University School of Medicine. She's also on Instagram at Dr. Marta Perez.